Run a 10K, feel fantastic, and yet have a Widowmaker blockage growing inside you without any symptoms. This phenomenon occurs because our bodies are incredibly adept at adapting to circumstances, effectively masking up to a 90% blockage in coronary arteries while maintaining normal blood flow, up until the point it completely fails. This reality underscores a grim statistic: half of all men may experience their first sign of heart disease as sudden death, rather than pain or discomfort. In this video, we will explore why a seemingly healthy heart can fail, how the body conceals these hidden dangers, and the methods available to detect potential heart issues before it's too late. To comprehend why a healthy heart might suffer failure, we must delve into its anatomy. The heart is a muscle that requires more oxygen than nearly any other tissue in the body. To obtain this vital oxygen, it relies on a network of vessels known as coronary arteries which encircle it. The term coronary comes from early anatomists who noted these vessels resemble a crown, but it's more insightful to visualize them as the root system of a vast tree. Much like how a severed root can cause a branch to wither away, a problem with these vessels can have devastating consequences for the heart. The two primary players in this system are the right coronary artery and the left coronary artery. The left artery branches into a significant vessel known as the left anterior descending artery, commonly referred to in the emergency room as the Widowmaker. The reasoning behind this alarming nickname lies in basic geometry. The LAD supplies blood to the front and bottom of the left ventricle, which serves as the heart's main pumping chamber. A blockage in a minor branch may jeopardize a few leaves, but a blockage in the trunk could threaten the entire tree. This blockage can halt the heart's ability to pump blood to the body, leading to widespread tissue death and catastrophic consequences. So, how does one develop such a blockage, especially someone who exercises regularly? To answer that, we shift our focus to the vessel walls. In a healthy state, these arteries are flexible, akin to a new rubber garden hose. The inner layer, termed the tunica intima, should ideally be smooth like Teflon, allowing blood cells to flow without friction. However, life introduces imperfections. Over decades, various factors like high blood pressure, elevated blood sugar levels, and smoking wear down this inner lining, functioning like sandpaper across its surface. Even the mechanical stress from years of rigorous exercise can cause tiny scratches and tears on the artery walls, which serve as the initial site for potential trouble. As these minor damages accumulate, your body instinctively attempts to repair them. In response to the scratches, LDL cholesterol is dispatched to the location, akin to using spackle to fill in holes. Following this, white blood cells are sent from the immune system to assess the repair. These cells consume the cholesterol, morphing into foam cells that eventually contribute to the hardening of the artery, leading to the development of plaques. These plaques can grow and narrow the arteries, progressively restricting blood flow. The problem compounds when the plaque ruptures, triggering the formation of a clot, which can severely block the artery and result in a heart attack. What starts as a body's attempt to heal could end up being a fatal ticking time bomb. This complex process reveals why understanding heart health is crucial, even for those who are physically fit. Recognizing that physical appearance and exercise habits don't guarantee heart health is vital. Regular checkups, including non-invasive imaging or other tests, can help reveal hidden risks. The journey to understanding and preserving heart health requires awareness of these biological realities. We must prioritize our cardiovascular health, adopting preventive measures and participating in screenings that can detect issues before they escalate into emergencies. By acknowledging that a healthy appearance can sometimes mask underlying dangers, we empower ourselves to safeguard our heart health effectively. Ultimately, this awareness, combined with proactive steps, is key to enjoying a long, vibrant life free from the shadows of undetected heart disease.
Within the human body, cholesterol, calcium, and cellular waste come together to form what is known as plaque, leading to a condition called atherosclerosis. A common misconception surrounding this condition is the idea that plaque buildup resembles a clog in a bathroom sink. Many believe that as plaque accumulates, arteries narrow until blood flow ceases entirely, expecting to experience symptoms like chest pain or shortness of breath. However, while this reasoning seems logical, it is fundamentally flawed. The human body exhibits remarkable adaptability. As plaque develops, the artery walls stretch outward to accommodate it, maintaining the blood flow. This phenomenon, known as positive remodeling, means that individuals can harbor significant plaque without any symptoms at all, leaving both men and women at risk. In fact, the first symptom of heart disease can be sudden death, catching many off guard just when they felt fine. But what causes this abrupt turn? The answer lies in the stability of the plaque itself. Think of plaque as a blister encased in a thin layer of skin. This soft plaque is susceptible to rupture. During intense physical stress or a sudden spike in blood pressure, that fragile covering can tear, resulting in a plaque rupture. Once the plaque ruptures, its contents leak into the bloodstream, triggering a panic response. The body dispatches platelets to form a clot, which is beneficial for external injuries, but catastrophic within the heart. Within minutes, the clot can grow large enough to completely block the artery, resulting in a type 1 myocardial infarction, leading to an instantaneous halt in blood flow. In contrast, a type 2 myocardial infarction often occurs in endurance athletes. Take, for instance, Robert, a 50-year-old runner with normal cholesterol levels. During a race, he may feel weak and lightheaded, misattributing these sensations to dehydration. However, upon reaching the hospital, doctors discover elevated troponin levels in his blood, signaling the death of heart muscle cells. Unlike type 1, Robert's heart attack is due to a partial blockage, around 50%. This situation arises when supply fails to meet demand. At rest, blood flow may be adequate, but during vigorous exercise, the heart's need for blood exceeds what the narrowed artery can provide, leading to ischemia. Additionally, Robert suffers from atrial fibrillation, which disrupts the heart's electrical rhythm, culminating in an urgent crisis where the heart beats too rapidly to fill adequately, resulting in insufficient oxygen delivery. Typically, chest pain arises when an artery is about 70% blocked, but many heart attacks occur in arteries with less than 50% blockage. This is largely because soft plaques are more prone to rupture than stable ones. Fortunately, the heart can adapt through collateral circulation, forming small detour vessels over time, which may explain why older individuals often survive heart attacks that could be fatal for younger patients. Physical activity plays a crucial role in developing this network. In the realm of medicine, we often say, time is muscle. After 20 minutes without blood flow, heart muscle begins to suffer damage, while after 90 minutes it can turn into scar tissue which lacks the ability to pump blood effectively. Heart attack symptoms may differ by gender. Men often experience classic chest pain, while women might feel fatigue, shortness of breath, or severe indigestion, and any sudden sense of doom should be taken seriously. When arteries fail, cardiologists intervene through a procedure called PCI. They insert a catheter to open the blockage using a balloon and then place a stent to keep the artery open. Early detection of cardiovascular issues is vital, as blood tests alone may not reveal the condition of the arteries. A CAC scan can measure calcium buildup, with a score of 0 being optimal while anything over 400 indicates danger. Likewise, a CT angiogram can identify soft plaque prior to it hardening, representing the best early warning system currently available. The phenomenon of heart attacks in seemingly healthy individuals often stems from a lack of awareness and understanding of their own health. It's essential to monitor blood pressure and sugar levels, remain active, and utilize the technology at our disposal to truly know our health status.